Hi everybody, it's David Porter. This morning I want to talk about PAWS, Post-Acute Withdrawal Syndrome. After someone has been using drugs and alcohol for an extended period of time, they will develop tolerance. That is, their body will adapt to the substances as best it can to help maintain homeostasis or equilibrium within our internal self-regulatory systems that manage things like our respiration, heart rate, and body temperature. In other words, the most critical functions for life. If you do large amounts of cocaine or amphetamine, you will increase the activity of your sympathetic nervous system. That is the go button in your nervous system. Take away the cocaine and your body is going to react by bottoming out. The parasympathetic nervous system will shut down, or excuse me, the sympathetic nervous system will shut down and the parasympathetic nervous system will take over. The parasympathetic nervous system is the stop button, and you will stop hard. You will crash. You will sleep 12 to 18 hours, get up ravenously hungry, and eat everything you can get your hands on, and then collapse again and sleep for another 12 to 18 hours. And this will go on, could go on for a week, could go on for 2. And one of the interesting things about cocaine withdrawal is it doesn't get better over time. The symptoms actually get worse over time and then peak before they gradually start dropping off. If you use alcohol or benzodiazepines, these are drugs that slow you down, that increase GABA, which is a neurotransmitter associated with lethargy, relaxation, amnesia, and a general slowing down of your body. In other words, it activates the parasympathetic nervous system, which is the body's stop button. Take away the alcohol, take away the benzodiazepines, and your body will go into sympathetic activation violently, a rapid rebound, and that's going to result in the exact opposite of the profound relaxation and slowdown response that comes from alcohol and benzos. So you're going to get tremors, you're going to start shaking, fingertips and eyelids is where it will be most noticeable, sweating profusely at room temperature. You will not breathe normally. You will start sucking and gulping air, taking sucking and gulping breaths. This can progress to grand mal seizures and respiratory failure, cardiovascular event, cardiac arrest, myocardial infarction if you're susceptible, which is a heart attack, cerebrovascular accident, which is a stroke. Benzodiazepine and alcohol withdrawal can be fatal. Modern medical care and methodology being what it is, the fatality rate for alcohol withdrawal is somewhere around 5%. 100 years ago, it was more like 30%. Excuse me. That is acute withdrawal, and depending on the substance, it's going to last anywhere from 72 hours to around 10 days. And it could be a little less, could be a little more, depending on a lot of factors. And then, of course, you have the misery and hell of opiate withdrawal. Opiates, heroin, fentanyl, Oxycontin, Dilaudid, morphine, Percocet, Roxicet, Loracet. There are many, many synthetic opiates. Using opiates, as I've noted in other videos on this channel, results in a initial orgasmic rush followed by 4 to 6 hours of a very warm, liquidy, relaxed feeling where basically all physical and psychological pain melts away. But there's a really big price tag attached to that. You take away the opiates and you're going to get sicker than you've ever been in your entire life. It won't kill you, but you wish it would. Sweating profusely, explosive diarrhea, vomiting, shaking, goosebumps, itching, which people have told me feels like your bones are itching. And you are going to be feverish and in delirium, mouthful of toothaches, head splitting, cramps, and that can last for, again, 48 to 96 hours depending on a number of factors. So this is acute withdrawal. It is a direct result of tolerance, and it tends to be relatively short. PAWS, or post-acute withdrawal syndrome, is much longer. Post-acute withdrawal syndrome is 6 to 18 months, and it's not as intense as with acute withdrawal. And acute withdrawal tends to be very specific based on the type of drug you were using. It's going to have the withdrawal syndrome is going to be very characteristic of the substance which you have been using. Post-acute withdrawal tends to be more general across different substances and more subtle. What's happening is your nervous system has been damaged, it's been slammed in and out of gear for weeks, months, more likely months or even years by the substances. And now your nervous system has to repair itself, and that will not be a comfortable process. Axons are the connections between the nerves. The long transmitting connections between nerves are going to wither and die, and others will grow and proliferate and make new connections. Neurotransmitter levels will go up and down. You will release more neurotransmitter than normal. The reuptake of neurotransmitter may increase or decrease. The receptor sites for the neurotransmitters may become more or less sensitive, and you're going to feel this. The characteristic post-acute withdrawal syndrome symptoms tend to be loss of neuromuscular coordination. You're going to find yourself dropping things, stubbing your toe more, bumping into things. When you go through a doorway, your shoulders are going to hit the door, the left or right side of the door. You're not going to walk straight, you're going to list. You may become dizzy, experience vertigo or the spins, feel like the room is spinning around. You may gray out and feel like you're going to faint. Obviously not a good thing if you're up on a ladder or driving a car. You may find yourself becoming highly emotionally reactive to very minor things. You may become enraged over small annoyances. You may cry very easily. You will have bouts of insomnia alternating with hypersomnia, that is excessive sleeping. And you may experience loss of appetite mixed with periods of overeating. Now, the good news is this will go away. The bad news is it can persist for 6 to 18 months. The good news is don't use more drugs or alcohol, and this will go away and you won't have to ever deal with it again. PAWS can be a factor in relapse because a lot of people who are experiencing PAWS will feel the urge to use their substance of choice or to substitute another substance, and that will take away the PAWS symptom, but now you're also going right back down the rabbit hole of addiction again, and you have just delayed the inevitable, because when you stop using, you're going to experience one more time acute withdrawal, and then you're going to experience post-acute withdrawal. All you're doing is delaying the inevitable instead of getting it over with and wrapping it up. So those are some of my thoughts on PAWS. Thanks for watching. Please hit subscribe and feel free to leave something in the comment section, including any topics to do with behavioral science, psychology, criminology, or substance abuse that may be of interest. Everyone have a good day and be safe.